everybody, this is Kim again. This is an update on percutaneous bilateral SI joint fixation surgery. I am 2 days post-operative, probably 2.5 days at the time we're videoing this, and just want to let you know that I'm doing great. Pain level wise, for me, I haven't had to take a pain medicine since 24 hours ago, and maybe a little over 12 hours ago at night I had to take something for anxiety spasms, such as a diazepam at night. But since waking up this morning, I have had no pain medication. Now, I will clarify that I'm a very alternate-minded person, and I do a lot of supplements, herbs, and vitamins. And to that extent, I do have supplemental herbal-based pain type of medication that will help for anti-inflammatory properties. And I'm a very strong proponent of using pure therapeutic grade essential oils. I specifically use the Young Living brand for 20 years of my life, and so I'm constantly massaging myself down with oils that help with pain. And the other product that as a key product to any of my post-op surgeries is been a product called Triamil, which is arnica, both an internal arnica homeopathic formula and also external arnica formula that you rub on your body, which again helps to pull out bruising. So I just want to stand up. As you can see, I can stand each day. Well, it's only been 2 days since surgery. You can see, I can stand up. Pain is just about where my fingers are pointed, is where the little patches are from the surgery. And across that area, in my hip area, is just where I have soreness. And everywhere else is doing fine. In fact, I will say that I was able to do a massage last night at about 5:30. We walked out of the hospital yesterday at about 1 o'clock. And as that lady massaged me last night, I was able to feel the difference in my leg muscles. I have suffered greatly with bicep femoris, the tendon area where it attaches to the lateral knee, and the IT band on the lateral side of my left leg. And then, yes, tightnesses and pullnesses on my right leg. But when the lady massaged it last night, for the first time in years, I could feel that the tissue was not pulled and irritated as much before she started. I was able to handle the massage. I have done medical type of massages weekly, solid, for the last 2 years, and nobody's been able to get that pain out of that leg. The main thing is because with a rotated pelvis, it creates torque and tension to the muscle attachments. And specifically in my case, the attachments to the ischial tuberosity area of my left pelvis, those hamstring muscles would attach. Well, my pain would be at the other end of those muscles, down here on the lateral knee, kind of right behind the lateral knee and then connecting into the knee. So I'm just giving these updates. This is my personal opinion. Somebody else may disagree with me, but it's what I've experienced, and it just feels great to know that the bilateral percutaneous SI joint fixation with 2 cannulated titanium screws across the sacrum has really put stability in my sacrum. Now, I must clarify that my sacrum was put into its neutral position by Vicki Sims, PT of Gainesville Physical Therapy. She is a national expert on knowing about SI dysfunction, and she knows how to mobilize, reduce, manipulate, whatever word you want to use, to put my pelvis into neutral. And she plays an integral part in the operating room with the surgeon, Dr. David Weiss, that did the surgery, but she works hand in hand with him as a team here in the Gainesville, Georgia area to set my pelvis in its neutral correct position before the screws are allowed to be put across So therefore I am got the screws in my holding my sacrum and my pelvis in true neutral position. Yes, a chiropractor can mobilize or say adjust your pelvis, and I've been adjusted weekly for 10 solid years by a chiropractor. Yes, he could move my joints into position. However, they would not stay in position really beyond really a few minutes. Before I walked out of the chiropractor's office, my pelvis would already be shifting. And so I couldn't maintain stability. And I did many years of physical therapy over the last 10 years, trying to maintain strength and stability to the core, but have only failed. And in my failure, it's not that I personally failed, but the failure would show up in my physical body. The failure would show up in the sense of my proximal, up the lumbar spine, more damage to my disc. L3 to 4, L4 to 5, both have definite bulges and fissures, and my L5 to S1 is basically a vacuum disc. It had a mass herniation in it 10 years ago. I had a microdiscectomy of of L5 to S1. The microdiscectomy took care of the blown out sequestered part of the disc and helped my foot drop motor function to come back. And I've done great from that. But yet the symptoms down my buttocks and the butt pain and the now no sciatica pain that I've been diagnosed with as a slight piriformis syndrome is, we're going to see how that turns out. Piriformis syndrome is very much related to SI dysfunction. About 40-some% or whatever the people that have SI dysfunction also will have piriformis syndrome. So we've just done the fixation. We're going to see how everything turns out from that and give more conservative care to my possibly damaged piriformis muscle that affects my sciatic nerve. And if I fail, continue conservative therapy for the piriformis muscle or that area, then there's a possible need for a piriformis release. But at this time, it's too early to tell that. But I can reassure all listeners of this video that the fixation alone has given stability to my pelvis that I can tell you I have not had prior to this event. And I'm very, very pleased and very, very grateful. And I must say that the Northeast Georgia Medical Center, where the surgery was performed, was top-notch in their service and their care. And again, I'm very grateful to the SI dysfunction team here in Gainesville, Georgia.